Hello and welcome to Healthcare IT Today. NextGen recently made an announcement regarding their Ambient Assist product. That's their AI tool that takes encounters and transcribes them into notes for their EHR. Well, I wanted to find out firsthand what this new announcement was, so I reached out, and Sri Velamoor, the president and COO at NextGen, has agreed to sit down and give us the details. Let's get to it. Sri, welcome back to the program.
Hey, Colin, good to see you again.
And I'm excited to have you on the program because you guys have just made a pretty big announcement regarding Ambient Assist. But before I get to what that announcement is, can you give us our audience a quick overview of what Ambient Assist is?
Yeah, absolutely. So Ambient Assist is it's AI-assisted clinical documentation that is intended to take friction out of the documentation process for physicians. So we understand that one of the biggest pain points for doctors today is the amount of time it takes them to do pre-charting and then create structured SOAP notes, and then of course fill in all the orders and meds and additional data that they need to get compensated on the tail end of it. So they spend roughly about a third of their time in each of those steps. Ambient Assist is the set of models that's meant to take the work out of doing those three stages of documentation and charting for doctors.
And what is the announcement that NextGen made recently about Ambient Assist?
Yeah, Colin, we rolled out our clinical documentation tool, the AI part of it, a couple of months ago. This is the next evolution of that documentation support. So previously, you used to be able to record your encounter on the phone, and it would turn that into a structured SOAP note, a clinically relevant and structured note that you could, at a press of a button, send it back into the EHR. Now we're able to take the transcript of that exact same conversation and take it to the next level. So the new announcement covers three things. One, we added Spanish language support. So we recognize so many of our FQHCs and CHCs are in communities that are bilingual or multilingual. So Spanish language support is one of the new evolutions of this. So you can have the conversation in Spanish, it translates that into English, and you can still put it all back into the EHR to click of a button. So that's one key evolution. The second one is what we're calling smart suggestions. So with the same knowledge of the conversation that the patient and the provider are having with each other, we are now able to generate recommendations on diagnoses codes, as well as lab and imaging orders by going back and referencing ICD-10 data sets. So previously, you would write your SOAP note, a doctor might need to then go back into the EHR, search for the appropriate code if they didn't know it already, and then try and recollect in some cases what the patient may have said, and then try to pick the right codes to enter into the EHR system. Now we're able to surface right in that mobile interface what the suggested code should be for the nature of the encounter that the provider just had, and they can verify that those are the right ones, and at a press of a button, it'll just write it into the appropriate fields into the EHR. And then the third thing that we added, and it does the same thing with lab and imaging orders as well. So if you said, hey, Dr. Sri, I just hurt, ACL tear in my left knee, and I told you, yep, we should do an MRI on that knee. This has the ability now to turn that conversational piece into an actual lab order that gets written into the EHR on behalf of the provider. So it's once again yet another game changer, because it's attacking that other third of the time that the provider spent documenting all this. And then the last thing we're adding is specialty model support. So there are a lot of generic models out there, but every specialty has unique data elements and discrete data that they collect, and the ontology and the clinical reference libraries that you need to document an ortho visit is different from an ophthalmology or a pediatric visit. So we are rolling out specialty-specific versions of this AI model that can do all of the three things I just talked about. And this announcement is covering cardiology, psychiatry, general primary care, pediatrics, and chronic condition management. And we're excited to continue to add more specialties as we go forward.
Sri, it's clearly you're very excited about the announcement that you're making and the new features of Ambient Assist. Why should a practice get excited about the new Ambient Assist?
Oh man, I'm really jazzed about this for them for a number of reasons. I think you look after report in the industry right now, and every doctor says that they're trying to do more with less. Every practice is trying to do more with less, right? 88% of practices say they have staff shortages. There's a 22% reduction in payments that's occurred over the last 2 decades. The denial rates have gone up by 8%. So all of the things we're talking about, the ability to take an encounter, capture it with as little friction as possible, not require nursing and admin staff to then re-enter codes and orders and spend extra labor to do that, And then, of course, ensure the accuracy of what you're capturing so you get reimbursed appropriately on the tail end. That's a complete game changer for providers. So not only does it improve patient quality, it gives providers 1 to 2 hours of their day back. It requires fewer admin staff to make sure that you're capturing all this information. And you're also improving likely your reimbursement rates on the tail end of this puzzle. So this is one of those rare win-win-win situations for every party.
And Sri, how can a practice get started with Ambient Assist?
Yeah, so for all of our NextGen users, they're able to essentially switch on a free trial where they can go on and test this capability out for a bunch of encounters. For those that aren't currently using it or are on our mobile product, they can reach out to NextGen Healthcare or their account manager or their sales executives, and we can get them going.
Awesome. Thank you so much for being on our program, Sri, and sharing all this great information about your new announcement.
Thank you, Colin. Great to be here.
Hey, I want to thank Sri for hopping on camera and giving us that quick overview of the company's announcement regarding Ambient Assist. I'm definitely encouraged by the company's efforts to continue to integrate their AI product more and more deeply with their EHR to, as Sri said, to remove that friction for their physicians. And hey, if you enjoyed this interview, please like and subscribe. Also, head on over to healthcareiTtoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.